Hi, everyone. Welcome back to Heart Health with Michelle. I'm here with Dr. Brian Lima today, and we're going to talk about heart failure. If this is a new diagnosis or even if it's an old diagnosis, what it is and what can we do about it? I couldn't have asked for a better person to talk about this with. Dr. Brian Lima is a heart transplant surgeon, a heart failure expert, and the author of Heart to Beat. I really welcome you to the YouTube channel, and I look forward to chatting with you today. If you could explain a little bit about yourself, your background, and then we'll dive right in.
Sure. Thank you so much for having me on. It's a pleasure to be here. And it's also always exciting for me to talk about a topic that's near and dear to my heart, pun intended, heart failure. So just a background about me, I'm a heart surgeon. I'm the surgical director of heart transplant and mechanical circulatory support at Medical City Heart Hospital in Dallas. And I've been in practice as a cardiac surgeon for 10 years, did my heart surgery training at the Cleveland Clinic, and also my other general surgical training at Duke, where I also went to medical school.
I love it. I love it so much. So let's explain to the audience, what is heart failure? You get a diagnosis, but
Right.
It's kind of confusing. What does it mean? I'd love for you to kind of get a little bit deeper into that.
Sure. So heart disease, heart failure, these are terms that are often kind of used interchangeably. But really, heart failure is a common kind of pathway. So, for example, if you have heart artery blockages, so coronary disease, valvular heart disease, all these different types of heart disease can eventually turn into or become heart failure. So heart failure basically just means that your heart is unable to provide enough blood flow to your body. So when that happens, it could range from a mild form of it, but like any other type of disease, there's a spectrum. So you can have the heart failure progress all the way up to kind of where I spend the bulk of my time as a heart surgeon, advanced heart failure, where we've pretty much exhausted medications, we've exhausted regular heart surgery, if there is such a thing. And we're basically having to think about, okay, this heart of yours no longer can cut it. We need to either replace it or implant a mechanical heart pump to help take over the work for it.
Right. So if someone gets newly diagnosed with heart failure, or even before we get there, so let's say someone's not diagnosed with heart failure. You mentioned earlier how there's a lot of these factors that can contribute to getting heart failure. So let's take a step back and say, well, what are the risk factors? Is there something that anyone could do to prevent heart failure? Because I feel like most people don't even realize that heart failure, it can be preventable, given that there's so many risk factors we can manage before it starts affecting the pumping ability of the heart.
Sure. So I guess some statistics would help, I guess. So the chances of any single person getting heart failure is 1 in 5. So 20% of the entire population will probably develop heart failure. And one way of preventing heart failure is to prevent heart disease altogether, because often heart failure is the sort of culmination of long-standing heart disease. And the reason why we're seeing more of it is because we've gotten really good in the medical community at keeping people alive longer with other kinds of heart disease. But the analogy I make, which some people find annoying or funny, but I think it's a good analogy, is if you have a car and you do everything right, all the scheduled maintenance and oil changes and do everything, at some point, whether it's 100,000 miles, 200,000 miles, that engine, that transmission is going to give out. And in many ways, that's one way heart failure kind of manifests. It's kind of the final culmination after years of heart disease. So if you can prevent heart disease altogether, that'd be great. And I always refer to as a simple way to take that on as the American Heart Association's Life Simple 7 things that anybody can do to take ownership and act on their own behalf to prevent heart disease. And we can get into that, but they're basic things like eating a heart healthy diet, exercise on a regular basis, make sure your blood pressure and your blood sugars are under control, your cholesterol is under control, don't smoke, don't vape, all those things. So there's 7 of these things that, one can do to minimize the risk of developing heart disease altogether.
Exactly. And if you have high blood pressure or you have high cholesterol, you have high blood sugar levels, managing it, right? If we take control and we are able to bring what's not supposed to be in the blood vessel into the cells, we're going to prevent our heart having to overwork. And when our heart overworks over time, the heart muscle can thicken, the heart muscle is going to overwork, but be put into overdrive, which can then lead to heart failure.
Right.
So, how does someone get diagnosed with heart failure? How does someone know, okay, I have all these risk factors? How do I know? Like, can you talk a little bit more about that?
Sure. So it's often they're very general symptoms, vague symptoms. So things like getting progressively shorter breath with exertion, so or even shorter breath at rest, not being able to lie flat because you get shorter breath, um, having dizzy spells like you're about to faint, general weakness. And often folks don't really know they have heart failure until they're actually told by a physician, usually. Maybe they even have to get admitted for heart failure. They just can't really catch their breath. They're just totally wiped out. They get admitted and they're told, well, you have heart failure. Your fluid, I'm sorry, your lungs are full of fluid, because if your heart can't pump blood forward to the body, well, then things back up. So fluid starts to build up in your lungs. You get swollen. Your legs can get swollen with edema. So that's usually how heart failure looks when we see it. And even it could get to the point where, unfortunately, which is what I see almost on a weekly basis, is when you can actually get into a state of shock. So your heart is so down, not able to meet the demands of the body, that your body shuts down and it goes into shock. That unfortunately happens too often, but so much of what I hope we will get into, and I think we will, is we don't want it to get to that,
Mhm.
that sort of very alarming kind of desperation type of thing. We want to be able to tackle the heart failure issue up front much earlier before we let it get to that point.
A lot of times I hear people get fatigued for a long period of time and they blame it on, well, for instance, postpartum cardiomyopathy. A lot of times people get heart failure after pregnancy and, they just gave birth to a child. So they're like, oh, well, I'm just tired. But they don't realize that it could actually be heart failure, right? A lot of times we say, oh, I was working too hard, or, oh, I'm getting older. And we blame fatigue or chronic fatigue. And a lot of times that's also a subtle sense of heart failure. Heart failure has so many stages. And a lot of times, I mean, you can tell me, you see it in an advanced stage because we're not listening to our body. We're not detecting it earlier enough. Or if we are detecting early enough, are we actually intervening? Are we actually adding in the lifestyle management, the medication, the actual thorough assessment and evaluation and management so that it doesn't progress? I mean, we had a conversation before, and I think it's really important we reiterate what you had mentioned before, right? So someone gets a diagnosis of cancer, they're brought to all these oncologists, they're brought to all these second opinions. Someone gets a diagnosis of heart failure, it's not really the same. And what should we be doing? You get a diagnosis, should we just watch and see? Is that really what we're supposed to be
Oh,
doing?
definitely not. I've been really outspoken about this, and I think it's sort of both the medical community and the lay public really do not look at heart failure anything like they look at cancer. You hear cancer and everybody gets very nervous. Wow, cancer, that's deadly. What do I have to do? Send me to the specialist. We need this removed, or I need chemo, whatever it takes. But you're scared into this whole almost protocol, automatic triggers for referrals. It's this sort of seek and destroy mission, right? No questions asked. You're going to do whatever you can to cure the cancer. It's that scary. Heart failure is more deadly than most cancers. It's far more deadly than colon cancer, far more deadly than breast cancer. It's almost as deadly as lung cancer, yet people don't think of it that way. If you have a diagnosis or have ever been told you have heart failure, your chances of being around in 5 years are 20%, 30%. And if you have advanced heart failure where you meet criteria, meaning you've actually required adrenaline medicine to help your heart, you've been admitted to the hospital because of your heart failure, your pump function's really low, your chances of being around it 1 year may be as low as 50% or less. And people just don't view it that way. And part of it also is the fact that, unlike cancer, there's very specific kinds of physicians that take care of cancer, right? Specialists. In heart failure, there's different kinds of physicians that can theoretically treat heart failure. A general practice doctor, an internist, a family medicine physician, even a general cardiologist. All of these different types of individuals can give the medications, which is kind of the early treatment for heart failure. Let's get some of the fluid off. That there's these new emerging medications which are really effective for heart failure. The problem is that they're not kicking it up a notch to, okay, well, let's hope that this can help, but in the meantime, let's get you to a heart failure specialist so that just in case things don't work, we are ready to pull the trigger on a life-saving therapy like a heart transplant or a mechanical heart pump, an LVAD, a left ventricular assist device, because there's a lot that goes into that. There's so much we need to know and figure out as a heart failure team, whether someone's a candidate for that. I call it, we have to take a good look under the hood, look at everything, A to Z, even social stuff. Who's with you at home? Who's going to be able to take you to appointments? Do we know you've all, gotten all of your cancer screening? You'd be surprised. And we had this conversation before that every week I see patients who are really sick, like in shock. This is their first time being told, I really think we need to look at whether a heart transplant is an option here. And they're completely not, surprised, tearful. And a lot of the things that we would need to be able to say, yes, you can be a heart transplant candidate, we can't say because they've never had their cancer screening. They've never had a colonoscopy. They've never had a mammogram or a pap smear or seen a dentist. And all these things that we take for granted that we assume is being done for patients out in the community, routine cancer screening, things like that, unfortunately aren't being done. So then it makes our task that much harder to be able to get what we know can help somebody to them as quickly as possible.
Yeah, no, I think it's super important. And I think your main message is you need to take a heart failure diagnosis seriously, because you can, if you don't, and you just kind of let it watch and see, the prognosis is poor. But if we're more aggressive, more alert, more understanding of what's heart failure? How does it progress? What medications do we need? What management? That's so important. And I mean, I see this in my field as well as being a cardiology dietitian and looking at the science of cardiovascular disease. People come to me with heart failure, and mostly it's a little advanced, or it's cardiomyopathy after pregnancy. It's not usually stage 1. It's at least stage B. So what I realize is that people are told, just don't have any sodium, low sodium diet. First off, the research now shows that we don't really want a very low sodium diet when it comes to heart failure, but it's more about the other nutrients. We see individuals who have heart failure who are deficient in so many nutrients. And remember, your body is in overdrive. So oxidative stress is very high in individuals with heart failure, which makes the prognosis that much worse. So if we're not adding in certain foods in the diet, that's also going to negatively impact prognosis and your heart's pumping functionality. So super important that we're looking at all pieces of the puzzle. And like you mentioned, going to someone who specializes in heart failure so that you're being proactive and you ask specific questions. You could say, hey, what does this look like in 5 years? It doesn't necessarily mean you're going to get a heart transplant, but if you don't act soon, then the chances of a heart transplant or needing one is probably much higher. And so I think it's super important that we discuss early recognition of this and making sure that we are managing it and seeking out those professionals earlier rather than later, looking at all aspects. And even if we don't have a diagnosis of heart failure or we're nervous because of other heart conditions, what does it mean? You mentioned the 7 things that the American Heart Association puts out, but
Right.
Looking into those things, plus sleep, plus stress, plus everything, because our hearts take a big toll, but we don't realize how much it does for us, right? It keeps us alive. And if we don't treat our bodies appropriately, it's not going to work for forever. And so we need to be looking at that whole perspective. One more question before we go on to our next episode. I wonder, people go in for echocardiograms all the time.
Right.
And when people come to me after a heart attack, sometimes they'll send me all their paperwork, but they have no idea what a lot of it means. And after a heart attack, if you don't get medical assistance promptly, it's very easy for you to go into heart failure. It's very easy for the pumping ability to be decreased. And I see that a lot. But most people don't know what to ask for. They're like, oh, I did an echo. I didn't hear anything. They don't know the ejection fraction. In terms of prevention, do you feel that people should be asking that? Can we talk a little bit about ejection fraction in order for people to understand what it means and what to look out for?
Sure, I'd love to. And one of the most important things that we assess when we're, looking at someone with potential heart failure, heart disease is, okay, what's the pumping chamber strength? What's its ejection fraction, which means every time that main pumping chamber of the heart ejects, right, that left ventricle, it doesn't eject all of the blood in the chamber. It ejects a percentage of it. So every time your heart beats and squeezes to get the blood to the body, it should squeeze out about 60% of the blood, the total amount of blood in that chamber, 60%. What we see as heart failure progresses is that number can get very low, down to 10%, 15%. And the heart can go from being shaped like a football to all of a sudden being shaped like a globe. It's large. It's twice, 3 times as large. The walls are really thin, which means, the nice, thick, muscular wall of the heart that's supposed to be able to do that, 60% is now thinned out. Sometimes it's all scarred out. So when we determine whether someone is at risk for deterioration, the heart is how it looks on echo, how low the ejection fraction is, how enlarged it is, whether some of the valves are leaking too. So as the heart enlarges, those different valves that are meant to sort of keep blood going in one direction can kind of get spread apart, kind of like a pinball machine, like the mitral valve. That mitral valve is only supposed to allow blood to go one direction. But when that heart enlarges, those leaflets can't meet in the middle. So blood is leaking all over the place. So are your valves leaking? How big is your heart? How low is the ejection fraction? These are all really, really important. And to put it in context, I think the American College of Cardiology decided to release some recommendations about what is it in someone with heart failure that should prompt a referral to an advanced heart failure team, a heart failure expert. And they call that the I need help criteria. And it's any one of those things. If you've had to have adrenaline medicine ever, if you've been admitted to the hospital because of heart failure more than once, if your ejection fraction is below 30%, if you have a defibrillator because of your heart failure and it keeps firing, if your blood pressure is low, the list goes on, but any one of those things should warrant a referral to a heart failure specialist. So patients should be asking about that. They should arm themselves with that information saying, okay, you told me I have heart failure. Well, how bad is it? How does my heart look on echo? How big is it? How low is the ejection fraction? And do I meet any of these other criteria? Shouldn't I be seeing a specialist, a heart failure specialist, just to be sure that I'm getting all the medications I should be at the dosages that I should be, and that I have all my ducks in a row in case this doesn't, get better? Those, I think, are the important key factors that patients should be looking into when they get told they have heart failure.
I think that's so, so important. We take advantage that, oh, everything looks okay. It's the same as last year. But what does that mean? We need to understand and be able to ask those questions so that we can be more proactive in our health. From my perspective, when I have individuals who have a low ejection fraction, I never say, I guarantee we're going to increase it, but I've seen the power of nutrition bring it up so much that we need to be looking at everything. We need to be talking with our heart failure cardiologist. We need to be speaking with all ancillary support in order to do everything we can to, help your heart pump better. It's so important. I think it's also this abstract idea, right? A lot of times, I know a lot of my clients will actually say, I feel my heart. Like most people don't feel their heart, but when it gets to a certain point where it's overworking, they feel their heart. And I always say, we don't really understand because we have our skin, we have, everyone is specialized or does their own work and what they know. But I think you really explained it perfectly of really understanding. Look at what your body is doing. Look at how everything functions because of good blood flow. And if you don't have good blood flow, you're going to not be able to think very well. You're going to be a little brain foggy. You might have cramps in your legs. There's so many things that come about, and we need to be more proactive because so many things from heart disease can become heart failure, and it doesn't happen overnight. It happens over years, and it usually happens silently. So we need to take ownership of our health and really look at it from all aspects. I think this was wonderful. Any last words that you'd like to mention, or one thing you want everyone to take away from this episode today?
Well, again, I want to thank you for having me on. I think I always get on a soapbox about this topic of heart failure. I just feel that the main take-home point is that it's never wrong to be preemptive, to take sort of ownership of any illness that you have, and heart failure really needs to be taken as seriously, if not more seriously, than cancer. And just like if you or a loved one were told they had cancer, what that emotion and fear would elicit, I believe it should be the same, if not more, for heart failure. So it's if you have someone close to you or know somebody, or you yourself have been told you have heart failure, please seek out a second opinion. Please request to be seen by a heart failure specialist. It can only help.
I love that. And this is coming from a very big expert in the field of advanced heart failure. You see it when it's all the way at the last sense of hope. So it's really important to understand what you do every single day and save so many lives. You're really trying to get people out of the OR. You're trying to get people to prevent all this. So this is just lovely. I really appreciate you. I appreciate your wisdom. Everyone, please follow Dr. Lima on Brian Lima, MD. Check out his book, Heart to Beat. And I look forward to having you on our next episode. Thanks for tuning in.
Thank you.